For all inpatient areas, when looking after a patient with symptoms of suspected COVID-19, they must be isolated to their own bedroom, preferably with ensuite facilities. For every episode of direct patient care, prior to entering the room, you must wear the appropriate personal protective equipment, carry out hand hygiene, and remove the personal protective equipment before leaving the room.
Use safe work practices to protect yourself and limit the spread of infection. Keep your hands away from your face and your PPE being worn. Change gloves when they're torn or heavily contaminated. Limit surfaces that you touch in the patient's environment. Clean your hands after removing gloves and regularly perform hand hygiene. This video demonstrates the A-lift technique. This technique should be used every time you wash your hands. We will need to increase the frequency of our hand hygiene, particularly before and after going in to see a patient, before putting your PPE on, after removing your PPE, and at regular points throughout the working day. If you do not have immediate access to suitable hand washing facilities, please decontaminate your hands using hand sanitizer, and then as soon as you have the opportunity, you should also wash your hands with soap and water. Before you put on your PPE, make sure you are well hydrated, tie your hair back, remove any jewellery, and check PPE in the correct sizes available. What you should put on is a plastic apron, which you should tie securely. After you have put on your plastic apron, you will then need to put on a surgical face mask. To wear a surgical face mask, you should position the upper straps on the crown of your head, above the ears, and the lower strap at the nape of your neck. Mould the nose piece from the bridge of the nose, firmly pressing down both sides of the nose with your fingers until you have a good facial fit. Finally, you should select a pair of gloves according to hand size. It's important to remember that the outsides of the gloves are contaminated. After removing your gloves, clean your hands with alcohol hand sanitizer. Next, you should remove the plastic apron by pulling it away, touching the insides only, as the outside of the apron will be contaminated. Bundle it up and discard it into the waste bin. Do not touch the front of your mask when removing it, as it will be contaminated. Reach to the back of your head and undo the straps, or pull them to rip them. Let the respirator fall away and discard it, only holding onto the straps.